Okay, good. Got it. It was not mine. Turn that on. Kill the volume here. Cool, so I can see you. That's going. So. Alright, how are you? You're set up nicely? You're comfortable?
Yeah, I can work in here on the side so
Okay,
give
cool.
out more space.
So, let me make sure. Cool.
I don't remember how to change the game.
Okay.
Alright, I found it.
Oh, not gosh, gosh. So the stream is up on the TV. The only thing is
Did you turn off the volume, like turn it down? Okay.
yeah, as far as I know.
If not, they're listening to us, you know.
Yeah, that's true. What's in here?
Pop, pop.
So wait to full screen this. This is something. Okay, I'm getting audio to the screen, which I'm okay with.
Hello.
As long as it's down on the TV, which I think it is. Good. Alright, so I'll run out there. I'll just confirm that the audio is down. And then we'll be good.
It's right next to the
One
syringe.
kiss, yep.
Long kiss right there. Okay, and that's all we're doing is one syringe.
Yep. I don't even know that she's gonna get a full.
And that's the other thing. So, one thing I've been talking about is we don't, like, do you guys talk in syringes or you talk about like a lip treatment or a lip enhancement? Because sometimes not, you're still gonna charge them for that syringe.
Right. Well, I
But-
tell people, there's a lot of people who say I don't want a full syringe.
And you might not need it.
Right, and I said, well, you might not need it, but
Yeah,
there's, it's like, it's a business.
right, so it's,
Yeah.
but everyone is always concerned with
Is your frame rate 30 frames per second or 60 seconds?
30.
Right.
Whether that is
Let's say I'm 60, starting at 60.
smoker's lines,
No,
or
double.
Yeah.
it's a lip enhancement.
I just set out the shoulder on 60, on 60.
Okay, cool.
So they're a little nutty about that. I feel.
Is your image interlace or
So I just thought that was a
progressive?
really nice approach. It's like
Good
a lip
question.
enhancement. You don't want to say augmentation because augmentation might
Not
hurt people.
And
sure.
I actually was
Should be fine.
Okay, looks like it's 130. Render.
No, but you're going in the camera side.
Oh,
In
okay.
the,
Oh,
the guide
camera?
thing.
Okay. I there we go.
I can configure the it's probably for hours,
Okay. It looked okay out there.
yeah.
Did everything
It's a little
good?
bit out of the canvas, okay.
Okay.
Just make this one small. Right.
Perfect. Cool.
And the image is a little bit cold, like the white balance
Yeah.
compared to the. I can try to fix that. I don't know how to do it here.
You know, I really.
Doesn't matter.
Well, no. It's if we have the time, you know, why not make it a little bit better? And it's funny too, because Cody told me, he's like, "Oh, I have an ST2 for you, which is a stagehand, but not really a stagehand, like a tech that builds stages." So like, I'm like, "Oh, okay, I have no idea who it's gonna be," but here you actually know the
I know.
camera stuff, so that really helps.
Yeah, just the color. I already set the other. I mean, I think it looks good.
Yeah.
It's a little bit too white. It's gonna take me a while to.
Okay, so I will. What I'm gonna do. Sure, this is off. Oh, sound, that's right. Cool. My pen is back there. Do you have a pen on you? Okay. I actually don't either. I have like a million in general, but not one in my pocket, unfortunately. But let's see. About 12 seconds. That's pretty good.
too narrow.
Oh. Yes.
It's too narrow.
It's warmer.
No, it's like crazy warm.
It's
man.
definitely warmer.
Yeah. It has three presets right here, but I don't see how I can.
Do it manually?
Yeah.
Okay. There's the auto white balance button at the very front.
That's them.
Yeah.
Whoa.
Nice.
Yeah, because
Oh, that
that's,
looks fantastic.
that's the outlet right there. Okay.
Oh, okay. But what a strange place to put it though.
Mm.
Yeah. I saw it today when we were around.
Lee, yeah, you're injecting first. You need to set up my rooms. I just set up my tray for the driller. But you, oh, you're doing that. Never mind. Never mind. I just took this
So the big thing too,
5 o'clock.
I have to remember to hit start recording.
She's like 4 o'clock, and then she's, oh, so you're setting up that.
So we still have 20 minutes, just so you know.
Okay.
And we'll be on our feet until 6:30. So it'll be like 2.5 hours ish. Not too bad. Let me go back to the logo. out there.
He would tell you.
Where did she go?
No, I don't know. Just going along with it, like, oh yeah, I probably just
Nice.
forgot. featuring, we're featuring a lot of things that people don't really realize we do. So, you know, facial veins, we also do leg veins. So, oh yeah. And typically if you're somebody who does have red veins, you're gonna be somebody who grows them everywhere. You know,
Yeah.
so we have a laser for that. It's called an LP, long pulsed YAG. It's a 1027 wavelength. It does not break the skin, but what we're gonna do is line it up with each one of these vessels. It's very satisfying to do because you just shut it down. So the laser is attracted to the oxyhemoglobin, which is the redness in that vein. All right, so it's gonna bypass the epidermis. It's not going to break the skin. It's gonna find that vessel, collapse it on itself so it can't carry blood any longer, and then your body reabsorbs that. So what that will look like is that area might be a little pink after the treatment. By tomorrow it won't be. And it's really a no downtime procedure. Okay? Yeah, really easy to do.
I did it maybe 12 years ago,
Yeah.
and this just came in.
Yep. Okay.
12 years, that's pretty good, right?
It does. And typically what happens is those veins are done. They're not going to refill because they can't. But if you're somebody who does grow veins, you're going to grow veins. And so what I tell people is, you know, check in once a year, especially the leg veins are even spicier when you get them treated. It's a little uncomfortable. So once we clear legs, I say don't wait for them to get so bad. Come once a year. Let's take care of them. It'll be a 5-minute treatment instead of a 30-minute treatment times 3. Get rid of them before they grow because they do like to grow like weeds. Okay? All right. So, who's going to stay in the room?
I'll stay right where I am.
Great. Goggles for you. Let's trade you. Okay. Goggles. Goggles.
What we do for today, right?
And
These two guys will have an
goggles.
appreciation.
Right. And you guys will be behind me, so we're good.
Oh,
Okay.
you do?
Would you like a set of goggles?
If you got them, I'll take them.
I do.
Hey.
Yeah, just a little extra protection. They may be a little dark, but better to be safe.
Oh, wow.
Alright.
I brought a bunch.
Awesome.
Okay. All right, Janet, relax, sit back, make yourself comfortable.
Okay, I've been in this chair before.
Mm-hmm. A little more conduction gel there. We have a couple little blood vessels. This is a very common spot for them. They're called alar vessels, and almost everybody grows them. And they're very, very difficult to remove. So that typically takes a couple of shots with this laser.
So what does the, well, I'll ask her, but what would you typically feel in your face if you were
I'll
having
let you
this
know.
done on your face?
You're gonna feel like a little rubber band snap and very pinpoint. You see this little, like you actually line that right up with that blood vessel.
I'll let you know if it's painful.
Snap. Okay.
Nothing. I didn't feel a thing.
That's good because we're gonna turn it up.
Oh.
Good.
Oh, boy.
Good, good. All right, here we go. I want to see them disappear with each pulse. Better. How we doing, Janet? Good.
Nothing.
She's a tough one too. But these are very tolerable. Like you can see that little spot size is super tiny, and that's the only thing that she's really feeling is that little tiny zap.
I'm not feeling anything really.
You're shutting down. Doing okay?
Mhm.
Good.
Did they go all right?
I mean, it really looks like it is, but
Yeah.
not that I'm an expert in telling.
Yep, just a little pink. That's all she'll be left with. There. So sometimes they disappear right away. Sometimes they turn a little bluish, almost like a little linear bruise. Both are good clinical endpoints because we know the body's just going to reabsorb that. And Janet's got nice thick skin, which is why I had to increase that intensity just a little bit because they're not so superficial on her. They're just
Oh,
a
they're
little
deeper, so
They're a
they're harder
little
to
deeper,
penetrate.
so the laser's working a little harder. I always start out with the lightest intensity because why over-treat and cause more discomfort if I don't have to? But this is her sweet spot. They're just disappearing before my eyes now. There it goes. Feeling those now? More intense. Good. Almost done. Yep, and then the nose. Let's not forget those. Those you might wince a little bit, right? Gone. Bye-bye. And I'll pause as you guys can look. Those vessels are gone. Beautiful.
She's not made
Take
it
a look.
okay.
Wow. Okay, everybody can take the goggles off.
Thank
We're
you,
all
Bob.
safe now. You're welcome.
done?
All done. Looks beautiful. Long mark on you.
Lower there? Lower?
Beautiful.
Awesome.
Thanks, guys.
Cool.
There's kind of two in one there.
hopefully from, you know, doing here will poke you in the eye.
Yes,
Are you comfortable?
Yes.
Okay. This is Apple. You guys are ready? I'm ready.
Alright.
Okay. Thank you, everybody, for coming tonight. I'm Maria Gherkin. I'm one of the nurse injectors here at Hush. Thanks for celebrating our anniversary with us. And I wanted to thank my beautiful model, Stacy, for coming in today. So I'm going to be demonstrating something called Colibri. It's a handpiece that goes on our Opus laser, and it works on benign lesions on the skin. So I would say probably when you're at maybe like your late 30s, early 40s, you start to see some benign things changing on the texture of your skin that we don't like. So some of those things could be maybe in the wart family. Some of them are something called seborrheic hyperplasia, which is just overproduction of sebaceous oil in an area, and the cell just kind of says blah. They're a little bit like a donut shape, maybe a little yellow with a dot in the middle, or a little white with a clear dot in the middle. And then also melia, which is something where the skin just gets, or the keratin just gets trapped in the skin. So this little handpiece here, you would see, this little handpiece puts all this strong energy right into this pinpoint. And that gives me a lot of energy to put right in the area that she needs it without giving her a whole lot of downtime. Generally, you don't see any scarring with this because it's such a fine tip there. It's usually pretty comfortable. I had my wonderful patient here numb up ahead of time with lidocaine, tetracaine cream, which really helps take the little zap off. And you'll see I marked her with some green dots because some of hers are hard to see unless I tilt her head quite right. We usually see them on ourselves in the magnification mirror, and we go, oh, I don't like that little spot there. And so this sort of zaps them off. I recommended for her that she probably need a minimum of maybe 2 treatments, and we'd space them about 6 weeks apart. All right, so if everybody's ready to start, I'll start. I knew I put you in place.
Yeah, you're small.
That's perfect.
Yeah.
Thank you so much.
Like a skin tag.
Yeah, it's great with skin tags and things like that.
Wait, I love the It's actually displayed out in the parking lot out there. Maureen, you look very pretty out on the big TV.
Guys, good to see you all. All right, we're going to do a little test spot first so that you know exactly what you're going to feel, just like we did last time, okay? And then it goes rather quickly. All right, so we're going to start on the turn to the left a little bit. And then we're going to start on this one here. We'll do a little test spot. 1, 2, 3. Not terrible, right? And then we'll do a little bit more on this one. Again. Perfect. And okay? And we'll do the same thing here. We'll do a little one here. And again. And so marking these with the green first really helps me find everything and get you a quick result. I'm going to turn this way. Some can be snappy back, which is okay. How's it going to you? Good. That was
Did you hear that?
Yeah,
Wow.
that's a good one. This one here. Come around to this temple here.
Oh, it's too dark when I get close to it.
There's 2 here.
I can't take it.
Good. Oh, we're halfway done now. That one's good. The bigger they are, I think the more you see that little snap. And we see one here.
People can watch it out there too.
Perfect. You doing okay? Yep. I'll do a little one here.
Right now, we were discussing.
And I will tell you, like, for anybody's listening, that I didn't numb in every place that she ended up like putting dots, and I was still super manageable. Yeah.
Good.
Yeah.
It's interesting, one spot, it looks like something like popped out.
Yeah, sometimes you'll see a little spark.
Yeah, oh, no,
Yep,
it was? Oh,
yep,
it's really
you almost wanna
interesting.
create a little
Yeah,
spark.
yeah, I saw it.
Yeah.
I mean, was it this one up here?
Yeah,
Yeah, I mean, I've heard
You
it.
heard it.
Yeah.
Is that usually what happens?
Squirrel.
Do you get nervous? No. Yeah. Well, I mean, when people are watching, because when I was doing makeup and people would watch me, I always feel
Well, it's the first time.
How long have you been doing all this,
Two.
Marie?
I'm a 6 year.
Me too. I'm Lisa.
I know, she wants to.
It's early here. Yeah. Sorry, Lisa.
That's okay.
Nothing like watching it.
How long is the downtime for this? Because I know some people can cut off like
Yeah, so you'll be cut puffy for a few days, and I say give it like a full 2 weeks for everything to kind of settle down before you love them or hate them. Because between the needle,
Sorry.
between the needle and the
Sorry.
product.
Sorry. Okay.
That way other people can get in.
Yeah.
I'm gonna
What product are you using?
wrestling kiss.
Where's the screen outside?
It's in the atrium. So if you go out here and make a left, you'll see it.
Yeah, I think I'm gonna go watch it on the screen.
Okay.
Are you excited?
It's the first time.
First time?
Yeah,
Oh my God, you're a virgin. You're a virgin lip filler.
very excited.
I can. Okay. Thanks. Goodbye.
everybody here. I'm Lisa, one of the injectors here. Thank you all for coming and for being my model. So we're going to do some lip filler, and when it's very important when we're doing lip filler to understand what a patient's goals are, and everything is very customized with anatomy and what you're looking to get. So when you look at your lips in the mirror, what about your lips do you want, enhanced or just restored?
Yeah, I think enhanced,
Yeah.
little fuller.
Yeah.
They've always been very tiny. One side's been lower than the other, that's always bothered me.
Asymmetry. Everybody has a little asymmetry.
Yeah,
in their
that's
face.
okay.
Yeah.
But it won't bother me as much when I look at it.
Yeah. So, as we age too, we lose a lot of collagen and elastin and hyaluronic acid, which is what gives our lips that soft, hydrated look. So the goal is not always just to get big lips. The goal is always to maybe just bring back what it used to be, right? And in your case, you said like you always had little lips, so we'll just enhance them a little bit and make them a little bit bigger. And it's always important too when we're looking at the face, the anatomy. I'm sorry, I'm not talking loud enough. It's always important to look at the surrounding anatomy as well.
Right in front of you.
You have a good chin, so.
I've seen this a million times.
So when we do lip filler, we do some numbing, just make sure it's comfortable. Some of the side effects, you'll get some swelling, you could have some bruising, and we always say to give it a full 2 weeks for everything to settle down and be where it's going to be. And then the products are different for everybody. So today we're going to be using Restylane Kiss, which is going to give us a nice, plump, soft, hydrated look. So, and then some other things too that we can treat other than just lips, like when we look at anatomy from people, sometimes people get little lines just from the collagen. Yeah, and we have fillers for that. Sometimes, if there's a weak chin and we need to give some support there, we can build that out, or even underneath just to make it just a little more youthful to match what we're going to do with the lips. It's kind of all, we want to make it all harmonious. But you have a chin, so we don't have to do that, and you don't really have lines here, so we're just really going to focus on building up your lip a little bit and giving some hydration. Yeah. So.
Sounds good, thank you.
All right, you're welcome.
But I had done it because I have all the smoker lines. Really just getting the lip done actually helped improve the appearance of the smoker lines. It actually did a really nice job.
Yeah.
I'm good with the ideas.
I have a scar right here that I never noticed until just a year ago. I've had it since I was about a year old. So I don't know if I think I'm starting to get lines just from aging, and it's making me notice it now. So
Just wait. Just wait, you'll get more. Just wait.
I always say we can't stop aging, but we can age better, right? So we can soften everything just a little bit.
Yeah. Kind of look at it in like the best version of yourself.
Exactly.
Yeah.
Exactly.
Yeah, and a lot of people get intimidated by lip filler because they see some big
some
lips
people
that
are
are walking around.
obnoxious.
We don't. It's not our goal.
Yeah.
We want natural, nice, soft. That's what we want. We don't want to look fake. All right, you ready?
Mm-hmm.
All right. So where's my freedom from everything? Okay, don't much breath. 1, 2, 3.
Do you want to hold my hand? Thank you.
Yeah, and it's just,
Amazing.
yeah, little teeny tiny bits just spread around, and that's how we get a nice natural.
So how much are you putting in her lips?
Well, I'm gonna play by ear.
Okay.
It's a 1 ml syringe. Sometimes people need the whole syringe. Sometimes it goes fast. Lips kind of will absorb that right up, and we do use the whole syringe. Other times, maybe not quite as much. So everybody's a little bit different.
filler.
Mhm.
But the filler itself actually has lidocaine in it, so once it starts to go in, it numbs a little bit, like it bathes the nerve, so it's not quite so complicated, okay? You wanna
I'll wait.
Can I look? Oh, wait.
I was just gonna show how it's just the one side,
Oh,
just
yeah.
leave it just a little bit turned up. Yeah.
Yeah, I can, I'll see it.
I'm gonna flip
yeah,
around to
done.
the other side.
And there's always gonna be swelling, right? So there's
Yeah.
swelling the first couple days, and you
Yes.
might say to yourself, it's too much, and that's why Lisa's saying, you can't love it or hate it for at least 2 weeks, and then you gotta let it all just kind of settle in, because the swelling will go down, and it will be like a chef kiss, no pun intended.
If I gotta work with people, there right away, I do that. To be like,
Yes.
I like literally was like,
My husband, I'm in this world for 20 years as a rep. My husband has no idea what's in my face.
no, I know.
Like, he's just like,
not
no,
a single person said
no, no, they won't. And I think it's good on Thursday.
Yeah, that's what I was about,
Or
I'm
come
thinking
home
about
on
Monday.
Friday if you can, and then
I know.
by the weekend or something, we'll be calm. You might have a little bruise. Blame it on Saturday. That's what I say.
You'll be sad when the swelling goes away.
Right, so swelling, well, that's what happens, Lisa, I'm sure you've heard that too, a little bit more, right?
I was like, is that me?
I know.
That's what people say, they're like, I loved it at day 3, and then,
Also, people with smaller lips too, we don't always just do all of it at once. Some people need like a slow build, right? So we do a little bit and then come back and we see how it is and we can add a little bit more. It's kind of just,
you stage it, yeah, yeah.
That's where Nicole was really good, because I'll come in and go, here a little more, no. Just a little more, no.
It looks phenomenal.
And this is Restylane Kiss, so as Lisa was saying, it's a really soft gel, and it integrates really nicely with your natural tissue and the movement, right? You don't want something that's too firm, like we were talking about that harder ridge. You want something really nice and smooth that integrates and moves with your mouth, so.
I had this done, maybe 8 months ago, I had very fine lips. And it was, and they were hurting down,
And it's got to come off.
Yeah. How long does it usually last? Depends.
Depends on
I would say maybe like 9 months. Yeah. Some people get a little like a
A
little
little longer.
Yeah.
Yeah, and that's 100%. You know, it's not like you're gonna wake up one day and it's all gone, right? It's a gradual return back down to your baseline and normal. So,
What was the length of time?
I mean, anywhere between 9 to 12 months that we would see, but you know, depending on how much movement, does your body just eat up HA a little bit faster? But what it is, it's not like you're waking up 4 months from now and it's gone, right? It's a gradual return, it's wearing off, right? So that's what goes on. In addition to the increase in volume and some definition to our lips, you get some it's hyaluronic acid, so it's very hydrating, right? So your lips become more hydrated. You get a little prettier pink color to your lips coming back.
I would always pinks them up really nice.
Yes, so nature's lipstick, kind of, right? Uh-huh. So sometimes when you forget, but at least you know that your lips are hydrated and they have a nice little pink tone to it as well.
I think you're right, because my lips used to be really chapped,
Mm-hmm.
but they're not anymore.
Yeah.
It's great.
You look fabulous.
Is that, I hear the $100 off any syringe or bottle, is that what we're looking at? Probably, but I am not 100% certain on that one, so with regards to the specials, let me.
Sorry, it's got some grease.
Probably I would check up front though. Cause I work for the company with the filler, so I'm not sure what they decided. So I'm like, I don't wanna, I don't wanna misquote.
Yeah.
Is that what it's $100 off syringe, is that the
Plus
best?
one.
Which is amazing. I always recommend it afterwards, because that gives the internal hydration. Is that like a cream or like a? Like a serum for your lips.
So there are some hooks, right? So that's why anytime you put a needle to your base, you can always bruise, right?
There's so many vessels that we
it-
just can't see what's under the
Yeah.
surface. I mean,
But they're pinpoint, they're tiny, yeah. So,
you feel that?
But not a lot.
Not a lot. I always look at patients' feet and hands to see if they're clenching.
This numbing cream would be very good. So if you plan ahead, we give you numbing cream to take home, so that way you can come already numb and not sit around just waiting. So usually like 30 minutes for numbing. So between that and then lidocaine and the filler itself. Little
And they're gonna swallow a little bit more, right? So they're definitely gonna swallow a little bit more tonight and tomorrow. Meter itself out.
15 seconds.
Oh, they look so good. Like you cannot even, like literally you will not even like.
Can I smile?
Yeah.
Okay, I'll mess it up.
That's amazing.
So you're using the same product, you just switched
I just
to
put it in-
Merkin? Yeah.
because it's a little bit.
Yeah.
No, it's one syringe.
It's one syringe.
Oh, okay.
It's one
It's the same one.
Oh, I
I
got
just
it.
put it in like little.
Yeah, so micro,
Yeah, I gotcha.
She pushed them out into smaller syringes, as opposed to using, so she can just fine tune and finesse the areas.
Okay.
Yeah, I didn't realize that you keep going back to different spots.
Oh, I do.
Yeah.
A little bit, you know, because we don't want to just push a lot in. It's a lot of fine tuning.
And after you have that, is it like Botox where you can't say a P or
No.
from a straw?
So no, good question. So the toxins, the neurotoxins, Dysport, Botox, they will stop the muscle contraction. So if you've had that, like a lip flip or anything like that, you can't suck on a straw or anything like that. This is just filling in under your tissue. So it's not affecting muscle, it's not knocking activity out of your muscle. That's all the neurotoxins like Botox is. So all your animated lines, so when you smile and you frown and you raise your eyebrows, that's where all, or down when you purse your lips, that's where all your Dysport and Botox are. Yeah, but this is just, we have volume loss, right? We're aging, we have volume loss, we have fat pads and depletion, so we're just kind of improving the volume.
Maybe a little more symmetrical. Get nervous, you know. Very close.
Should we drop that? I felt something.
Ray, really? She's
Stressful and everything.
I did that, it was really fine. Today was horrible. This is her first time, she's never had the flu at her house, and yeah,
She was saying she was in that she never
Doesn't matter how much numbing cream matter all the way. That shows the value of help. She's Don't come near me.
Yeah, yeah.
She's somebody who is a good guy for building up. She's a little.
She was.
Yeah, yeah.
She what?
She was.
So, Friday, is your full Friday?
And then what we do after is just peel them and smooth out any little lumps and bumps.
That's what we're doing.
Oh, okay. Yeah, and it's darker there. I was like, okay, hold on.
Peel them as you're probably more so.
Go by his house, they looking at us on the TV.
Oh, you are?
It looks great.
Yeah, you look great.
You will not even ready. You won't notice, but you will.
You're good.
Ooh. Yeah.
It looks awesome.
Just a little bit.
Yeah, I got one.
Thank you.
So good.
Absolutely.
Thank you.
She was a Jackie here,
Amazing,
I'll come in.
amazing.
Thank you.
You're gonna be very happy.
Oh, is that okay?
Thank you. Thank you.
Of course, thank you for coming. It really looks
Yeah,
nice.
thank you.
Thank you.
Yeah. Now, should I do ice?
I'll give you a little ice pack.
treat adipose tissue, but it wouldn't be necessarily it's not the same as cool sculpting. It's more for like fine tuning, so it's good for treating submentum if there's some adipose tissue, some fat in here. If we do cool sculpt, I'll treat the abdomen afterwards. If they want a little bit of tightening and just a little bit more fat reduction, yeah. Or even we'll treat gels with adipose reduction back there. So, yeah.
If there's more people that want to come in, you can come in over
Here,
here.
and I can scoot over for you guys. You're welcome to even sneak around me if you need. Everyone can come in.
Oh, we're a good one.
Yeah.
Vivace is really cool. So one of my favorite parts about the Vivace Ultra, we used to have the original Vivace. It was tried and true, and most people loved it. We've got awesome results from it. But this specific device has an ultrasound component, so we're actually able to read into the skin. You can see it down this way and see how deep the dermal and epidermal layers are. So that way you're not guessing anymore about how deep to treat, how shallow to treat, if you went deep enough, and especially if you go too deep, because most people think the deeper you treat the better, but actually there's fat lying under there. This little section here is what is called like adipose tissue. Once you start treating into that, you're actually able to melt the fat and therefore reduce volume. So you kind of have to see where you're treating versus just guessing, or else, yeah, it's. Okay, so I already did our ultrasound scan just so we can get started today. We're going to be treating this region in between the upper arm, lower arm, just because our lovely model here, Patty, say hello, even though I'm sure you've spoken to most in the room already.
Everyone.
She has a little bit of laxity in this way due to some recent weight loss, and we want to just tighten that back up. So let's see here. Our depth is automatically transferred. We're going to treat here. Let's see. RF treatment. Start treatment. So you guys are going to get to see the ultrasound because that's top notch. Alright, so
Is that this? Yes. This. What do you want the results? How many treatments did you?
1.1. We're going to go with the first one.
I guess you not tan.
Alrighty.
You can't be tan. No, she said to her.
Most lasers are best treated without color on your skin. It just allows for us to treat a little bit more aggressive, and then you end up with a better result. It's not to say that we couldn't treat if you had some color, but we have to be so mild that it's, you don't really want to weigh out the risk reward.
And how many treatments do you recommend?
Depends on the area, the severity of what you're treating, but anywhere we sell packages of 3 or 4, and then you want to keep maintenance of at least 1 to 2 a year. So I would say if you're looking for more improvement, you're going to want to do more than just 1 a year for maintenance. You're going to want to keep improving until you're happy. Alright. And we already clean, sanitize, alcohol, acetone, the whole 9.
Don't be scared. We got you, Patty.
We're going to start here with
We got you,
girl. We're going to set our depth, our power level, our RF time. Everything's good. We're going to start this treatment. Okay. Awesome. Alright, I'm going to start on the lower arm and work our way up.
Nap time.
Alright.
I can't believe I fall asleep during this stuff.
Here we go.
And you're probably pretty numb, right? You feel pretty numb?
You're pretty numb, right? Yeah, so we numbed for about an hour beforehand with Saran wrap. Once we utilize the Saran wrap around the numbing, like you can see on that arm over there, it does allow for that numbing mixture to penetrate the skin a little bit deeper.
And if this was, let's say this was her face or jowls, would she have downtime? Is it red or dry
Yeah,
after?
so Vivace downtime varies
a good amount, dependent upon which treatment you're on, if you've had it before, your skin's tolerance. But you're not going to see a crazy, necessarily swelling reaction to the skin or even redness. What you're going to see is minimal downtime the first couple days, and then after that, you're going to end up with tracking, meaning you'll see where I stamped each section of needles at.
So little scabs where the little needles are.
You're going to see little scabs. It's going to look like a square. Chances are, unless someone's really, really close, it's hard to notice, and at that point in time, you are able to wear makeup over top. I always say that right after the Vivace, you usually get this like great glow the next like 2 days. You get a little bit of swelling, everything looks good, you get that initial bout of like happiness of seeing it work, and then you get a little downtime, but to really start seeing those results, it starts at about 4 to 6 weeks, and those results will continue over the next few months while you're still progressing through your treatments. You feeling all right? Yeah, you're gonna start to see reddening up in here soon. Because I can see where you're reddening up. Because I do.
That's why, she's an extra.
Yeah, so a little bit more about the device itself. We're using a tip that has 60 needles on it. There's a larger tip, this tip we use on the body, and then for the face or more detailed areas, we have a 36 needle tip, and then we actually have a 4 needle tip for specifically around the eyes. So you get a nice brow lift with it, you get a nice wrinkle reduction under the eyes. Yeah.
I think I want that.
And you can see you're starting to redden up.
Guess what's selling out tonight?
It's a really cool treatment. This is one of, I mean, it's hard to pick your favorite, but it's nice because it's also so custom.
And you look really comfortable on me.
Yeah, she's nice and
Yeah, don't know, right, lift it all.
yeah, the numbing is an important part. We do recommend, especially your first treatment, we like for everyone to come in and numb, have one of the providers numb you, and you get to sit, relax, and we'll clean you up when you're ready and get started.
But no alcohol prior.
No, you don't want to drink beforehand. It will increase bleeding, swelling, all things you don't want.
So you said initially you used the ultrasound.
Mm-hmm.
Why aren't you using the ultrasound to guide yourself now? Where to go?
So before everyone came in, I took a few different ultrasound pictures of different parts of her arm. I wanted to just show you what it looked like going through it. But we'll take ultrasounds. We took one of the lower portion of the arm, the upper portion. The face is a little bit more specific. We would do everything from forehead, nose, under eye, above the eye, different
So like you
sections of the
compare
cheek.
before and after?
You could compare
I mean,
before
like
and
what's the
after.
purpose of doing the ultrasound if it's not guiding you?
The ultrasound shows me how deep to treat.
Got it,
Yeah,
okay.
you don't want to treat too deep or else you start to melt fat instead of just skin tightening.
Got
So
it.
you start battling yourself.
Okay.
But that's not always a bad thing. You can treat adipose reduction, stay under the chin. For some people, jowling areas, I've even done abdomen, so both are useful factors of it. How you doing?
Eyelids with
Above the lid. So
Above
what
the
we
lid,
do is
okay.
we actually kind of pull up on it until the lid is on bone, and then we're able to treat. You just don't want to treat inside that orbital room. Yeah. Yeah. You doing good?
Oh, I'm great.
You're right where we're at still? Good to go. Yeah, the old Vivace we had was 3 passes, which was much more uncomfortable. Being that we only have to do 1 now, it makes it available to a lot more areas.
Go over the second time.
Nope.
Wow. Oh, I'm liking this.
Yeah.
I would never even have thought to do my forearms. I feel like I have so many other problem zones that I would not even.
The forearms are a common one, surprisingly. Forearms and knees. Like we get a lot of right both and
No,
knees.
not that I don't need it there, I just feel like I have other areas that are worse.
Right now for
Yeah,
now.
exactly.
Alright, so are you comfortable like this? I'm gonna treat 1 row lower down
Yeah,
here.
that's right.
I wear sleeves so much.
Thank you.
Thank you everyone for joining.
Patty, good job.
Sorry.
Good job.
Great job. Thank you. That was great.
Good. Okay. Want to switch over to that other arm?
The what?
Switch over your other arm. It does. Okay, I'm gonna come over here.
looking at wearing 3-quarter sleeves, which that's not so bad.
Alright.
But
I think we'll head out. We can set up for our next room.
Thank you guys so much.
You're welcome.
thank you.
and it's actually very comfortable. It treats in 2 separate stages with this little device right here. And it causes disruption in the layer of the dermis, the stratum corneum. And when it causes that disruption, it allows the product to penetrate into the skin. TED has a primacy level of antioxidants, stem cells, peptides that get infused into the skin. So we always recommend that you go to see your dermatologist first so that you can get it clearance on whether your hair follicles are viable for growth, because sometimes the hair follicles are dead and there's nothing you can really do about it. And in conjunction with the treatment, you would also use nutritional vitamins, oral Rogaine or topical Rogaine, because it all works synergistically together. And it's super easy and it feels really good. It feels kind of like a little massage. And when you come in for the treatment, we section off the hair, which for a time I'm not really going to do. Usually do 6 spaces in the head and 2 to 3 inch ends. So we're just going to here. You can hear that vibration. And you just keep it going in the circular motion. How's it feel, Bobby?
Feels comfortable. Definitely nothing to worry about. Like you said, it feels just like a comfortable massage.
Is this something you're thinking about doing? Or?
I've never heard of it before.
No, yeah. There's all kinds of methods today for hair restoration this way. People find it's pretty powerful. It works pretty well. You do it in a series as well. 3 treatments, 3 to 4 weeks apart. And this just stimulates and disrupts that stratum corneum so that 53 seconds from now we can add that proprietary point. the stratifornia living her own. Encourages those young girls. You ladies don't need this at all. You have lots of hair, you don't need this treatment.
You don't think so?
You have lots of hair, yeah.
I failed the flashlight test.
It's that down lighting, really. Shows everything, doesn't it?
It's really comfortable. There's no kind of discomfort. As the hair gets tight, you can pull a little bit.
And how many sessions did you say?
3 to 4 weeks apart. And then some people need more. And also too, it's, I really stress by this treatment, and kind of follow the normal it's just not good.
Okay.
Yeah, it's important to do. But you can sit back, you can read a book, you can take a nap.
And how long do the sessions take?
Probably close to an hour from start to finish. After this one, you move on to another section. How are you? Good, how are you? Good. Ladies, come on in if you like.
Yeah, I'm doing great.
That's what I think.
Hi, how's it going? Oh, so cool. This is my friend Lee. How are you? Katie. Nice to meet you. So nice. Yeah. Beautiful. Thank you. So I'm cleaning up my end to the demo. I gotta put this laser tip somewhere before it gets lost. Okay.
I did, yeah. She was up my butt as always. That's alright. She's usually pretty chill with me. I just work from home. She just has to learn not to sit right behind my chair so I don't roll over her car or anything like that by accident. We do, but she usually just stays at Bree's parents' house while we're there. But they do get along well. Yes, they do. Yes, they do.
All right.
Water.
Let's continue to do this throughout
While I'm here, I was talking to my mom about getting some more Nutrafol as well.
Nutrafol is really great product. They have has all the vitamins in it that you need daily for us for
I know last time I paired up the two, so saw some noticeable differences.
And how many treatments of this did you have previously?
I think it was 3, I believe.
And what did you notice from your treatments?
Honestly, it was definitely getting a little thin up top there. And what felt like whenever I run my fingers through my hair, would have a lot of hair in my fingers when I would take it out. But paired with the Nutrafol, after the treatments of this, I just noticed a lot more fuller hair up there. I noticed actually some new growth up top as well. Definitely made it a bit more thicker than it was previously. Definitely try to avoid wearing pants as much as possible. But that definitely does not help with trying to keep the hair in the top of my head. So, but when I do the Nutrafol paired with this treatment, I saw a lot of benefits from it.
Yeah, it really does work best together.
I did the whole kit and caboodle too. I had the Nutrafol shampoo and conditioner as well.
So we have the instant now too, which is really nice. Have you tried that?
I have not.
It's nice.
Okay.
It's a nice shampoo and it's in addition.
Nice.
It's so easy and it's pretty much all you do. About out of time, right?
The next one starts in 9 minutes.
actually, so, yeah.
I'll make myself scared.
Yeah. I think I'm waiting for my other esthetician to come in.
Okay.
Oh, there she is.
Hi. Hi again.
Is
It feels good to sit down. My feet hurt so bad.
that's what I figured. I'm like, this would probably be nice for her to sit.
Yeah, just want to take
One day.
Yeah,
I know.
Yeah, I only had like 2 people in my room.
Oh, okay.
So they're, I mean, they can watch it out there, but maybe.
So they're not getting audio out there, the TV's muted, but,
Oh, okay.
but we are recording it as well, maybe for commercials or something, so if you wanna,
Oh, want the audio.
yeah, if you're able to present it. I'm sure-
Jonathan will put it on Instagram
Yeah.
eventually too. So.
Yeah.
You're seeing me from like.
Yeah. Yeah, just to close the little bit. Oh, that's good. That's good.
Hi.
There's enough people took yours. Yeah. That's perfect. Let's see.
And like at the same time. And I had you, who would you suggest you go?
So,
This is Tony or Martha? Okay.
right here.
Oh, yeah. Okay. Okay.
So, yes, we're here together.
I know you're a big girl.
Thank you. Yeah. Yes, I'm healing.
Was it painful?
No.
No, not at all.
No, I just have to keep it nice.
Yeah.
Lasers. Can't care about that. She had a necklace.
Really? Great.
He did a great job. Yeah,
Yeah.
Dr. Spilkey's pretty phenomenal.
You know, I'm gonna have
Put it.
my. I'm talking like Nicole.
On you. Oh, okay.
I heard he's good.
Just right in Tom Burton Road, like off the road. I remember seeing that. That's a special VR. Oh, really?
We went to St. Mary's.
It was fun. I know it was a value member. Yeah, it was quite relaxed.
Yeah. Somebody did a brown. I'm meeting, I have an appointment in 2 weeks. Yeah. Morning, ladies.
Hello.
How long was your downtime? Like a week. Oh, wow, that's great.
So this is versus one of our estheticians, and we are promoting our skincare club. So we have a monthly membership with our skincare club. It's $129 a month. You get a dermal clean, a facial, hey Lynn, the Sensi Peel, and all your products added on as well.
You get a facial every month?
Yeah.
And the dermal peel, all that every month for the $129?
Yep.
$129.
And then you get 10% off on products, $50 off on filler, and 10% off on lasers. So, and it's really nice too. Just keeps your skin in really great shape. And then if you want to do like an upgrade, like a deeper peel, you just pay the extra for that. But
Has anybody had a dermal plan before? Yeah. Do you like it?
I did like it. Yeah.
Makes your skin feel really smooth.
But you get, what about the hairs? Does it make the hairs grow back thicker or? Yeah?
we would all have 5 o'clock
Yes.
shadows if that were the case.
Well, I don't have dark hair, but I have that fine baby hair.
It'll always stay that same texture. Yeah.
Okay. Now, but you don't want to have it done. Right,
Yeah.
peach fuzz would turn into.
So what you're doing takes off dead skin cells and that kind of stuff?
Yeah, so the main benefit of a dermaplane is to exfoliate the skin by removing those dead skin cells. Removing the facial hair is kind of like an added benefit to that. And so when we do our facials every month, we're pairing this dermaplane with like a light chemical peel because it actually helps when we do the dermaplane to readily absorb that chemical peel afterwards. Because that whole kind of layer of like hardened dead skin cells has been removed.
Allows everything to penetrate
Yeah.
to work its magic.
So for $129, you get the dermaplane and the peel
Yeah.
every month.
That's
So-
normally $160.
Yeah.
Does the face get red after you're finished?
I mean, like a rosy glow, it's gonna it depends on every person if they're a little bit more reactive or not. And that kind of subsides within like 30 minutes.
3 minutes?
Yeah.
Okay.
It's mainly the manipulation of the skin. You can see how she's kind of pink in the skin right now.
Yeah.
That's super typical. Then that fades.
The books are relaxing.
Can you explain to them, Trish, what do you feel like it feels like when you get it? Just like a white scratchy? Yeah.
That's not pain.
No. Have you ever had a derm?
You have not.
Thank you.
Thank you. Now.
You would like it.
She likes everything. Oh, well, this is wonderful.
Oh, you do the neck too?
Yep.
Okay.
I've done both times. She's fabulous.
When you do that to the neck,
Oh,
does
yes,
it
I
like
love her.
help with any kind of like sagging or wrinkles, or is that something totally different?
That would be something different. I think that this is mainly just like making the skin appear more brighter and smoother, and removing the dead skin cells.
Okay.
A form of exfoliation.
I like it.
It's satisfying. I do it to myself once a month, and it really does, it helps a lot. But when you think about it, you know, if you think in terms of like age management, by making the skin seem more brighter and even toned and smoother, that kind of aids to that age management aspect, right? Because if the skin is kind of dull and lackluster, it kind of emphasizes those fine lines and wrinkles a little bit more. So where this isn't like mainly geared towards reducing those fine lines and wrinkles, it kind of adds as like an added benefit to kind of like enhance the skin and soften it a little bit in that way. Does that kind of make sense? Yeah.
What is threading?
Ready?
Yeah.
Like for
I've heard of people
like PBO
saying
threads?
they get their face.
Oh, that's like a different form of like for eyebrows and stuff. You mean?
No, for
People
their
do it on their faces
face.
too, yeah.
I thought you were talking
What is
about
that?
I don't, they use threads just to
Is
get
it
rid of the hair.
Similar to doing what you're doing
So,
here?
so threading is different in the fact that it just takes off the hair.
That's it.
That's it, yeah.
Okay.
And it's, from what I understand, it doesn't feel good. So
I've
it's
had it.
not,
Doesn't feel
yeah.
I would rather get waxed any day.
Really?
Yeah.
Yes. It's pain. Instead of gonna go get mine threaded, and I was like, I don't know what that is. So I'm like, I'm trying to.
I've heard it for
Thank
eyebrows.
you.
Yeah, I never knew it was.
So they do that for eyebrows?
Yeah.
Do it. Oh, I don't really know what
I
it is.
know, but I didn't know what it is.
They use a string, and they use the friction of the string to pull out the hair follicles.
Oh, really?
Yeah.
That sounds painful, just thinking about the procedure.
Okay.
Yeah, I'd rather do waxing any day. Just because it's like what, like you rip it off and you're
And you're
done.
done.
You know?
Exactly.
Do you do that at home, waxing, or do you?
I'm not a
Go
waxer.
somewhere.
I have to go somewhere. That's like a whole different beast. I would wax my entire fur off if I did it myself. Give me like a scalpel, I'm fine. But like, if I had to like shape my own brows, I would not be here.
So you do this in combination, then you do the peel.
Yes. Yeah.
And what kind of peel is it?
Well, so the standard like monthly membership includes a Sensi peel, and what that is it's called a modified Jesters, and that's a combination of different ingredients. It's a percentage of trichloroacetic acid, salicylic acid, or acetic acid. So when you're thinking about all three of those different acids, trichloroacetic acid works on like texture, fine lines, it helps to reduce inflammation. Salicylic acid is going to help with congestion in the skin, making those pores like squeaky clean. And then lactic acid is like our hydrating acid. It helps to kind of smooth out the skin, but then it adds that hydrating property to it.
And what's the downtime on that? Like, nothing?
I mean, The downtime, I would say, is more about just being mindful of not going to the beach the next day, right? Don't go into any hot saunas in the next couple of days. You don't want to introduce any extra heat into the skin that you don't need to. In
Or
terms
sun,
of,
right.
yeah, exactly.
What's the lasting effect of it?
Of the chemical peels. So think of it as the acids are super concentrated serums. So the serums that you put on your face can only be penetrated so deeply. When they're in a concentrated form of the chemical peel, those can get in there more faster and deeper. And what that benefit of is if you do that long term, it makes the skin healthier, the textures improve, you get that glow to the skin.
It takes longer to come out.
What do you mean?
Well, you said it's deeper.
Penetrates deeper into the skin.
Yeah.
So it's targeting the levels of the
okay.
skin that we want it to. That, like a serum that you would use at home would be able to do.
How does a chemical peel go over on someone with super sensitive skin?
So there's different tiers.
Because some people I work with get it and their face literally like is killing all their work. And I'm like, I would be more anemic. And I have sensitive skin.
Yeah. It all depends on, maybe that was a medium depth chemical peel that they did. We have superficial chemical peels here where you wouldn't even, I did a chemical peel of myself 2 days ago. And like, yeah, you can't even.
Like my skin turns red really.
And that's to be expected, like it will turn red if you're a little bit reactive. It'll subside in like 30 minutes, if anything. But a lot of the peels that we do here are more on the superficial side so that you're able to do that consistent exfoliation once a month. Low and slow is kind of like, it's a nice approach for certain people. And we can get there with the chemical peels. That's not to say that I can't get aggressive with them, because I can absolutely, if somebody needs a little bit.
Are you guys ready? You let me know when you're ready. You guys ready? Yep. Okay, so I am putting tempo filler. Rachel, here's our model. So the reason why we decided to pick tempo filler in here, we've already lifted her cheeks a few weeks ago, kind of helped with some of the volume loss she's had. And you see we have this little hollow here. So people think, oh, I need lift. We go to temple. You use normally in the cheek. It mimics your cheek and it lifts. But this hollowing in the temple kind of gives us almost like a skeleton look if it gets too thin. So what we do is we put the volume back there. Not only does it help lift more of that off the back here, it also helps lift some of that laxity in the eye. So it lifts your brow, some of that natural loss you have in your brow. It brings that back. And you're going to see it, because I'm going to do one side, and you'll see the difference between one side to the other.
Yeah.
She does. Well, we're very specific in how we inject her Botox, because we like a big brow lift. We don't go, we're very specific, right?
That's
Her
right.
brows are good though.
Yeah.
Are those tattooed? No. They're your own? They're
Yeah, I mean, I like pencil them in.
Yeah, but you
Fell in love.
yeah.
Yeah. I
You
fell in
didn't,
love, but
but you didn't lose all your brows in the 90s.
no, oh my gosh, thank gosh. So
You didn't get
many
the
of
90s
my friends
thin
didn't
brow.
make it, I know.
No, a lot of my friends didn't make it. I said my lipstick color right now reminds me of 90s high school.
Yes, Nicole.
It's very, very 90s.
But
It's
it's
all
back
back.
now. It's all
Yeah.
back in.
We never had any brows at all, right?
We picked them until they were like the thinnest, right?
Never really.
I know.
You'd be like my mom. She razored hers off in the 70s because
Stop
she loved
it.
David Bowie. And then we got hers tattooed not too long ago because we got tired of her drawing and mom without her glasses on.
And then one eyebrow would be up here and one eyebrow is down here, and I'm like,
Open your mouth. So the reason why you open your mouth, I can see the deepest hollow. And people worry about temple filler. It's very safe. I am feeling and I know my anatomy and I am marking my anatomy before I inject. I'm feeling for the bone placement and I'm marking that out. And then I'm palpating for the arteries. And we are very, very specific with the amount of education we get on anatomy here. So. You're going to reopen that and inject, okay? You're going to feel a little times kind of like your a little pressure. And how many injections? 2 pumps. So, okay. Yeah, and if you have anything more than like a 2 hour transfusion,
So if you're really hollow, probably Nicole or one of the other injectors would maybe fill you in 2 sessions. You might not want to, in that area, put too much at one time. So, you know, they would probably a syringe on each side and then reevaluate if you were super hollow and needed extra product. It's not.
And she put numbing cream too.
And all of the Juvederm products have lidocaine in it. So as soon as you make the first like extrusion, you'll start to numb in that area. So she had external numbing cream put on, and then the products have numbing. Sorry. Oh no, you're good. Elaine, check it out. Let me get one. Come on. She just had it done. Go girl. You're gonna look faboo. I don't think she looked faboo. No, she didn't, but I can't wait to see this. You don't feel that?
It just feels weird. It does. No, I don't feel it.
Not painful, just
No, it just feels weird.
You hear a little bit of
Oh,
hygiene.
it does not. It's less than Botox. It's just a weird feeling. When she's like when it's going in, you don't feel it at all. But when she's
come on, sit for it. Now you see the hollowing out here? And it's a little heavier here. I filled that in. And it lifted a little bit here, and it lifted her brow a little tiny bit. You can see the difference. Now, that vein looks a little agitated because it just heats when we rub around there. That'll go down in a couple, minutes, 10, 20 minutes, but yeah, and that's it. See,
No more, see how to get that hollowness in here? Now we get that, which gives you a little bit more of a lift.
It's a smoother transition.
Yeah.
Just
Yeah,
pressing my
so
cheek.
you go from here to cheek, and then you get a nice all in, like kind of. That's why I love to do the temples and the cheeks together, because you're lifting here and here at the same time. So you kind of come back. You're complete the whole time.
I didn't really tell the difference on the jawline.
Yes.
It looks
That's the
amazing.
most important part to
So,
me.
you can really see. You can really see. You don't think that lifting here lifts it here, but no, you think when you're always trying to lift up, you're trying to lift up. That's why everybody's doing those new vertical facelifts where they go from the top instead of the side. So we're kind of mimicking it to get like a 70% improvement without surgery.
Yeah.
All right, we're gonna do our other side.
Beautiful.
You got it matched
I've got to do it now.
So you want to see side by side?
Yeah, can I take a look real quick? Yeah, thank you.
And you can definitely see the difference in all the areas, like your cheekbone.
Oh, yeah.
No, when I did trees, I thought I did one and a half.
One and a half, okay.
I kind of thought I was going to need one and a half on her.
Yeah.
So I just pulled three.
Thank you.
Isn't it amazing?
It is. Yeah.
I told you.
And
You
it's
don't know
not
you're missing
too much.
it. You don't know
No.
you're missing
Yeah.
it until you get it. Yeah. People don't believe them until they do.
Any questions while she's moving over to the other side?
How long is the wide again?
So, Voluma is indicated for up to 2 years. What we recommend is that you don't wait the full 2 years to maybe come back in, and usually you wouldn't need the same amount the next time you come in. But the whole purpose of injectables is to, have a natural restoration, right? So if you're treating to completion and then you're letting it go back down, like your tank on, people will notice.
So what I tell everybody is, we're originally doing it, we're going for correction. You're using 2, 3 syringes depending on your area. Some people only need half and half, depends. But like when you're doing your cheeks, we might put 2, 3 just to lift those cheeks. That's because we're correcting what we're doing. Regular Botox or your regular treatments, we're looking, and then we might decide, all right, we're about 18 months out, let's do half and half on each side and just maintain it. Because you don't want to go all the way back down again and then have to just take that big expense again. We're always aging, so we're always maintaining. So it lasts 2 years, but 2 years to go back to baseline. You don't want to go back to baseline. So you kind of just tweak it, especially when we do like our little sales. Oh wait, Luma's on sale. Why don't I get that and get that half syringe in? That's kind of the way I like tell people to do it. So would you mind handing me that?
Yes, what do you need?
Full syringe on
Oh, this one?
I'm not like in my own out, kind of to the side, but
I called them.
Yeah.
I'm a rocket. I am a rocket. I'm a rocket. I'm a rocket. I'm born here thinking of my husband. So it's a little funny. Wow.
Yeah, that hurt. Yeah, I tiny hands. Well, tiny hands are hard. Usually I do, but I feel like maybe you're sweaty. Sweaty, yeah. Scott always says that I trip and fall over my own feet. He says it's because I'm top heavy. I should be.
That's why she's
Yeah. Pressure, yeah. Not like moving my through and down.
It is significantly good.
You can follow Gina, you can follow people. You know.
pains we do, right?
For all
Yeah.
the pain,
Just
I
said,
just let me
right?
stick up for like 24 hours, and during the other man, I just advocate on my cleaning and everything. And I put stuff in their face now.
That's all I'm worried about. Oh, the arteries.
The arteries, veins, I can see. Arteries are what I'm feeling.
Yeah.
I do not want
We're
to
good.
filler in an artery.
No. Yes.
That's why we're so.
Avoid it all
That's why
costs,
we're
right?
very specific about anatomy, and I take my time feeling and marking out.
Said you're going to do that.
Veins, they just bruise. Arteries, not so good.
Now, what is that?
This is enhanced post-injection serum.
Okay.
So it has arnica in it, so it helps with bruising. It just helps with, just to smooth everything out after injection. So the big thing with injections, I always tell people, I stress the most, is I went down and touched the bone. We don't want infection. The chance of infection is very low. So like what I try to stress to people is clean your makeup brushes. People don't realize how dirty they are.
Cell phones.
Cell phones. Why can't people alcohol swabs for their cell phones and glasses before they leave me?
And keep your hands off your face, because I can't tell you how many times we've done trainings with models, and afterwards they mark what they look like, but
Your
they're
skin
they're
has so
touching
much
their face.
bacteria on it,
Yes.
and it's fine because it's your normal bacteria, but you don't want it
adding
inside.
yes.
Same thing, change your pillowcase.
Yes.
Those are the main things that I tell you that people don't think about for post-injection. Those are like the most important. Nobody wants an infection, the chances are very low, but an infection can spiral out to a whole bunch of other things. That's why we're very specific of how it's clean and what I use, and switching needles and everything. So. All right, I think we're done. Anybody have any questions?
Do you want to sit up? It's easier for everyone to see. Sleep on the side here, and I'll give you a mirror. Do you want me to stay under? No, sit good. Okay. Nicole.
All right, so we try to get people to sleep on their backs. If you fall asleep and roll over on your side, you just have it low over swell.
It's so subtle.
I'm especially side sleeper, and I sleep on my side at the time, wet your pillow. Yeah, it won't, no, it won't make much of a difference. Because once it's, after like 4 hours, it's kind of where it wants to go. Yeah.
And why do you do the temples?
Because people get hollows, and the temples help lift. If you see, this actually lifted more. Because I already lifted here, and I don't want to make somebody's cheeks too big. And also, when you do a cheek, and this is hollow, then you get like that ridge. You ever see people that look like they have Maleficent looking? They're like at a ridge. Or I always say, if you know the 80s Skeletor, their face kind of gets that Skeletor look to it. Because you put filler here without it here, then it's too much of a contrast. But also, when you get laxity in your eyes, she has great brows, so I can't show you as well. It actually lifts your brow a little bit because you lost volume in your temple, that's why your brows drop. When you put volume in your temple, you get your brow lift back. So, it's not a black, but it's pretty close to it. All right.
Any other questions?
Thank you so much. Want ice pack? I know, I'm not. Oh my God. It does. Yeah. Wait till he takes pictures. I'm going to have to come back with it. I mean, it looks. Did you look?
I did. I love.
No, like I can tell just by looking.
Were you saying that it'll settle like in a couple of hours?
No, like you're not pushing it. Not that much, yeah. No, it really did lift that bottom so much more.
Because that's really
That's
my
what we're working
my
on.
goal.
That's what we're working on. That's
Yeah.
what we're working on. Yeah, I think you're a perfect model. Thank you so much.
All right.